Does the Vampire Facelift PRP really work? Is it practitioner dependent? I have severe thermage damage, fat loss, etc. Will this benefit the damaged tissue and plump? It's very expensive, so I wouldn't want to waste my money.
Thank you for your question. You expressed in your question, first and foremost, that you have had severe damage to your skin, including fat loss from Thermage. And you're asking, does the Vampire Facelift work? Is it practitioner dependent? And of course, you do mention the expense of doing this, and it's understandable why you're being cautious. Well, to give you a little bit of a background about myself, I'm a board-certified cosmetic surgeon. I'm a fellowship-trained cosmetic oculofacial plastic surgeon. I've been in practice in Manhattan and Long Island for over 20 years, and I am a member of the Vampire Facelift network, and I certainly have been very prominent about the education of patients about what a vampire facelift is. So I think we have a real opportunity here for you to learn what it is before you decide whether or not it's right for you. So to begin with, I spent time with the creator of the Vampire Facelift, Dr. Charles Runels, who developed this idea of combining a hyaluronic acid filler, and typically, by definition, with the Vampire Facelift, it's one syringe of a hyaluronic acid filler. And that is in combination with the use of platelet-rich plasma. Now, I, like many other doctors and surgeons, when I first heard about this, I was circumspect about it. I was suspicious about the name and the inaccuracies or the misinterpretations that the individual can interpret who sees the word vampire and facelift. For me, it didn't make any sense. Well, of course, the general population who is interested in rejuvenation very much embraced this name. The term vampire facelift has for a long time actually outranked in terms of search the word Botox. So you can imagine the level of popularity of this term, and it has received a lot of media attention because of a lot of prominent people celebrities who have had this done. When I first looked into this, I thought, why is it called a facelift when there is no surgery being performed? Well, Dr. Runels explained this to me, and of course, from his perspective, it has a certain validity, even though it's not generally recognized in the surgical community in the same way. When we do facelifts in cosmetic surgery, we're lifting things upward. When Dr. Runels came up with this name, he thought of it as lifting the face outward. When we think of facial aging, we think of volumetric loss, not just sagging. There's two elements: volume loss, bone, muscle, fat, soft tissue, and in a situation like yours, iatrogenic or loss related to a medical procedure or cosmetic procedure where there is volume loss. You feel deflated. And then, of course, facial aging is about sagging. Well, it is very important to at least understand that when he says that it's about a facelift, he's talking about an outward lift. In other words, everything is lifting away from the bone. As we get older, we can describe someone as becoming more skeletonized. When you're young, you have all of this beautiful fat and thickness and skin quality that's beautiful, and as we get older, we lose that, and in a much older person, you can see a lot more of the underlying structure. Okay, which is great, and the vampire name, of course, derives from the element of the procedure that uses platelet-rich plasma and platelet-rich fibrin matrix. So let's just understand what platelet-rich plasma is and how platelet-rich fibrin matrix is related. Platelet-rich plasma is a concentration of the wound healing, growth factors, and necessary elements of the blood that is required when you have a cut, as well as the cells needed, called the platelets. Observations in oral surgery and in orthopedic surgery have already validated the benefit of platelet-rich plasma in tissue where you want to expedite healing. In our practice, we've used it in many ways. We've used it for skin quality, we've used it for scar treatment, we've used it in combination with acellular matrix for hair loss, for a procedure we call hair regeneration. So there's no question that platelet-rich plasma has a lot of value. The challenge we have is in the perception and the misinterpretation of what it can and cannot do. Many of our colleagues believed that platelet-rich plasma could be a replacement for fillers. It cannot be. Platelet-rich plasma improves skin texture and quality. It improves collagen, it improves the healthiness or the viability of the fat cells, it improves blood supply, vascularization. Basically what we lose as we get older, platelet-rich plasma plays a very good role in helping this tissue. I've used it also in reconstructive and very complex cases where people have had issues such as facial cellulitis, infections, and in other areas where they've had scarring, and I've been very successful with helping to rehabilitate the skin with platelet-rich plasma. So, in terms of the Vampire Facelift, which is a very specific trademarked name, and only people who are in this network have had training as well as experience in this particular treatment. It is a specific way to do a combination of hyaluronic acid filler to restore volume in areas such as the lateral or outer part of the eyebrow, the cheek, the outer corner of the lips, and PRP to help improve skin quality and glow. There's no other filler that can make the skin glow the way PRP is able to. So that brings us to the topic of practitioner dependency. It's not a generic procedure. No procedure is a generic procedure. When people or prospective patients call around and ask, how much do you charge for Restylane, Botox, Juvederm? I always feel like they miss the big picture altogether. These materials, whether it's a filler or a blood product, by themselves, they are of no value. It is how the doctor applies these treatments. There is an art to everything we do. There is a judgment. So when you choose a practitioner, it's very important that you get the sense that this doctor has a lot of experience with this material and understands your situation. Thermal-based damage of skin is becoming finally a greater and greater concern. Unfortunately, the medical or cosmetic industry is dominated by the messaging of very large market capitalization companies that can really flood the media with the latest, greatest heating devices. And what happens is it creates a lot of demand. And patients find themselves going from one thermal device to another thermal device to another. Or they stay with one thermal device and the doctor keeps saying, maybe after they get the disappointment from the first treatment, well, let's go higher, let's get deeper. And what ultimately happens is the tissue literally gets burned. The fat under the skin, as you've experienced, literally gets cooked away. And that fat is so critically important. Now, I've had a lot of success in helping people with PRP who have had this thermal energy issues, but it is not likely to bring you back to a very vibrant quality if there's a lot of fat loss. Once the fat is burned or cooked, then it's very difficult to do anything to get the tissue back to where it once was. but it does require examination, it requires judgment, and it requires you investing time and probably some money in order to meet with doctors who have experience with PRP and learn about what your potential benefit is. It is it's a reality that more and more people are searching for solutions for the trauma caused by thermal devices. Again, it's not the device itself. We have Peleve in our practice. It's a radiofrequency device, but I use it in very limited way for very specific indications. I don't use it as it is perceived, or like in its class of devices are perceived as non-surgical alternatives to cosmetic surgery or ways to tighten skin that is getting loose. Just doesn't work that way. So, so PRP, in summary, is a very good way to help improve your skin quality. Yes, it is practitioner dependent. There are ways to inject it. There are methods, the levels you inject it at, how you inject it, how you mix it. There are a lot of different things. So you should meet with doctors who really understand and use PRP a lot. And as far as the vampire facelift, this may or may not be the right thing for you if you're looking for specifically rehabilitation of your skin. If you're looking only for rehabilitation of your skin, then you don't necessarily need the hyaluronic acid. But that requires, again, an examination. So I hope that was helpful. I wish you the best of luck. Thank you for your question.